So like I said, welcome everybody. Thanks for joining. Today we're going to talk about rights and the HCBS final settings rule. Most of you, I hope all of you have heard of the HCBS final settings rule, but hopefully most of you have heard of it. It's something that governs our work. It's one of the many pieces of regulation and policy that govern the work we do on our home and community-based services waivers. But it's something that I don't know that we have really done a deep dive in it with service coordination. And it is something that, as you'll see, intersects a lot with our conversations around participant rights. And so that's why we felt like it would be a helpful topic to talk about in the context of the rights training series. So today we're going to talk about the final settings rule itself, the background and intent of the rule, the 10 federal requirements, and then some of the probing questions and examples of noncompliance for each of the 10 federal requirements, and then modifications of those 10 requirements. Then we're going to talk about how this interacts or intersects with our state law and division policies. And then what do we do when we identify issues with the final settings rule? So the final settings rule itself, the history of it, it is federal regulation that was promulgated by CMS in 2014. So it's been around for 10 years now. I think it was originally planned that there would be a 5-year transition period for states to come into compliance. And then at some point it was extended. The deadline for full implementation and coming into states transitioning to compliance was extended to 2023. And so the regulation went into full effect in March of last year. But we've been living with this for quite a bit longer, and kind of in those years between 2014 and 2023, kind of finding a path towards how we're going to assess and monitor compliance and bring settings that aren't compliant into compliance, educating, division staff, providers on the expectations of the final settings rule. So this second box on this slide is really important. What settings do the HCBS final settings rule apply to? So a lot of folks get confused. They think that these are things that govern all waiver services. In fact, I was talking with somebody the other day and they were like, I don't think we can provide services in this setting if there's not a lease in place. It was on the 80 side in a sober living home. And I said, well, if it's not a provider controlled setting, the final settings rule doesn't apply. And the lease, that's neither here nor there. So when we talk about the final settings rule, the things we'll talk about today, those federal requirements are only applicable to provider owned, leased, operated, or controlled settings. On the DD waivers, that means group homes, shared living homes, host homes, and day sites operated by DD providers. So your hubs, your workshops, etc. But it doesn't apply to people who live in their own home and get intermittent services. Now, all of our regulations and policies around rights still apply to those situations, but it doesn't apply to participants who live with a family member and receive intermittent services, or live independently and receive intermittent services, folks who only get community integration, but they never go to a hub, a workshop, that sort of setting. People who only receive supported employment. Supported employment can only be delivered in settings of competitive integrated employment. So those are not operated and controlled by the provider of that supported employment service. So all of our rules and policies around rights and those types of things still apply to those settings, but the final settings rule is specific to what takes place in these settings. So the intent of the final settings rule kind of has 3 elements. The first one is to enhance the quality of services and person-centered planning. The second one is to add protections for participants in waiver services. And there's a couple different ways that the final settings rule requirements do that. And the last one I think is really the most important and really tells us the scope of what CMS was trying to do with the final settings rule. Participants are integrated in their communities and settings do not have institutional features. So some of what led to the development and promulgation of the final settings rule is that CMS was, going out and visiting states and, performing their oversight. And, there was a big push years ago to get people out of institutions, especially folks with DD, get them out of those ICFs and those, state-run institutions and things like that, and get them into home and community-based services settings. And that was a lovely sentiment, but, CMS kind of looked around and said, all right, we got all these people into community-based settings, but they aren't more integrated in their communities. They, when we go out to some of these settings, it looks and feels um, like we're at an ICF, or like we're at a nursing home. All we did with the push to get people out of institutions and into home community-based services settings was change their geography. But those of you who may have been around for a while may remember Dr. Tom Pomerantz. Many years, not many, but like years back, he did a lot of consulting with our division. And one of the things that he said was institutions aren't places, they're a state of mind. And so even though we got people physically out of institutions, we were still supporting them like they were in institutions. And we didn't really change a lot about their quality of life or their experience or their integration in their communities. And so the overarching point and intention of the final settings rule is to have participants have lives that are like yours and mine and not the same as what they would have in an institutional setting, just at a different address. And so as we talk through the requirements, keeping that in mind and, thinking about that when you go to your, do your service reviews and things like that, like it happens to me all the time. And I actually was a QDDP or, a team leader at an ICF. And so sometimes in my work in home and community-based services, I'll see things and I'm just like, geez Louise, I would never have been allowed to suggest that in an institution, working in an institution. Like they would never let me do that with a participant on my caseload at BSDC. So the fact that it's happening in what is, supposed to be a more inclusive, less restrictive setting, those are some of the things that CMS is talking about. So being mindful of that really kind of sets a tone for the things we're going to talk about from here. Any questions about any of that? So I'm not going to have you read all of these. I just wanted a slide. So there are 10 requirements, 10 provisions of the final settings rule laid out in federal regulation. So here they are all on one slide. So we're going to go through each of these requirements and I'm going to give you, we're going to talk about it a little bit. We're going to look at some of the questions. So CMS, because regulation is intended to be broad. Like they had to write this regulation so that it could speak to and be meaningful regulation for assisted livings, DD group homes, shared living homes, all of these different types of settings serving different populations. And so they're written kind of broadly or kind of using ambiguous language. And then from there, CMS gave guidance. And one of the types of guidance they gave to help states understand what they're defining the compliance with the final settings rule regulation looks like were some exploratory questions. And so we're going to go through some, I have just not all of them, but a handful of exploratory questions that CMS gives for assessing compliance with all of these different things. And then some examples of things that you might see or that we do see or have seen that could constitute non-compliance with the final settings rule. So I know a lot of information is on each of these slides. I'm not going to read it to you, but we wanted this not just to be something that was helpful visual aids for what we're going to talk about today, but also something that can be a reference for you all going forward. So on each slide, we're going to have the regulatory component, the exploratory questions here in the bottom left, and then examples of potential non-compliance that you might see or that we have seen. So the first requirement is the setting is integrated in and supports full access to the greater community, including opportunities to seek employment, engage in community life, control personal resources, and receive services in the community to the same degree of access as people not in Medicaid services. So our participants should have the same ability to access public places, the same support to be a meaningful part of their communities to the extent that they want to be, that they shouldn't be segregated or kept away from their broader communities. So some of the questions CMS gives us to kind of look at compliance of this when we're looking at a situation: does the participant engage in scheduled and unscheduled activities in their community? Because we all know that there's times when we have, oh, I have a salon appointment, or, church is at a certain time and date. And so we have those scheduled activities or times when we, go to public places, see people, engage in social groups, whatever. But we also typically will be out in the world at unscheduled opportunities. Oh shoot, I have to run to the store after work because I forgot blah 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 when I was grocery shopping this weekend. Or, oh, spur of the moment, a friend asked us to go out for dinner, let's go do it. Or I don't really feel like cooking tonight, let's go eat out. Those are things that we all do in our lives. And sometimes we see participants, in services, well, you didn't tell us you wanted to go on an outing, so we can't do that tonight. That isn't how any of us live our lives. That isn't how any of us access our communities. Now, I understand if they're reliant on support and, there's a certain number of staff and, other participants involved in group living situations, like there's some elements that are, out of necessity a bit different because they need the support of GD services. But sometimes that isn't really necessarily the barrier, and sometimes it's an excuse. And so our providers need to be actively doing what they can to support participants to access the community as they want and prefer. Can the participant come and go as they choose? Does the setting provide opportunities for a variety of age-appropriate, meaningful activities? Is this setting, and so some of these are more relevant to day settings or residential settings. CMS actually has separate exploratory questions for residential and day sites, and I have a link to them in the resources at the end of the PowerPoint if you ever want to look at those yourself. But just wanted to put that out there. Is the setting located amongst other residences, businesses, etc., to facilitate integration? I remember pulling shifts at a day site. I don't know if it's still open. I really hope it's not. For a provider here in Lincoln, back when I was in college, I worked at a group home, but I did some shifts at the day site on occasion. And the setting was like off in an industrial park. Like the only things around it were like storage units, and like it wasn't in a place where there's foot traffic. It isn't a place where any of us would go to the gym or the salon or out to eat or anything like that. It's sort of like segregated away from the broader community. Those are the kind of things we're sort of talking about. Does the setting have information available about opportunities for employment, volunteering, and recreational activities and support participants to access them? And do the participants have a way have access to the personal funds to spend as they wish? So some things that you might see that would be potentially non-compliant with this. This last one, a participant can only access their money by going to the provider's business offices on weekdays during business hours. I know that this happened, I want to say in Auburn or Nebraska City. A participant didn't have a guardian, but for some reason their checkbook was at the provider's like offices or at the day site, and they could only get more checks if they went there during business hours, which I was like, oh, no, no. Not to say that providers can't support participants with managing their funds, and a lot of times the providers are their payees, but there need to be arrangements for if they have a sudden expense on a weekend or just a want to go out and spend money and they need, you know, more checks or their checkbook or their ATM card or whatever, that they can access that somehow, or there's petty cash that then gets reimbursed from their funds on Monday or something. Yeah, the first example, participants has to schedule ahead of time if they want to go to the store, the library. That again gets at that unscheduled activities. Activities available only include children's things like puzzles and children's puzzles, coloring books, and movies. I know that there has been in different areas, it's come up more than once, discussion around like what movies are appropriate for participants to see, and things like that. So all of those would be things that kind of speak to this element of the final settings rule. Any questions?
I can definitely see where some of the activities can come into play. Um, However, I know that I personally have somebody on my caseload who loves the Disney movies, the kids Disney.
Disney adults
And
are a thing. I don't get it, but it is a thing. And so none of these things are absolute. I know that everyone would strongly prefer that I could give them black and white answers about what is and isn't restrictive or compliant with the final settings rule. Just like with rights, none of this is absolute or black and white. The specific circumstances that it's happening within matter. Um, and so in that situation, I would hope that they're offering a variety of things. And so if they're only offering those, kind of more children's things to
Mhm.
everybody in that setting, that would be more problematic than, oh, we have these Disney movies and coloring books because this is something that so and so is, that's their hobby or that's something they're particularly interested in. But that
But
also
didn't
shouldn't,
have, but like if they didn't have adult movies as well as,
yeah,
adult coloring books and adult, arts and stuff to do that, I can see that. Okay.
yeah, or if they, say that person lives with three other adults in a group home and they only watch Disney movies because that's her preference, but they don't have other activities that they support others to engage in if that's not their area of interest, that could also be something that is difficult.
Makes sense.
Um,
That makes sense.
Carrie asks, so my girls that basically never leave the hands of Heartland Group Home unless they're going to day services or out of compliance. I mean, it depends. um, if that is their preference, I personally, for example, hate going places and doing things. Um, just generally. So if I am not doing something that I really like or doing something that I have to do to survive or making money, I don't leave my house either. If you check my life 360, I did not leave my house from when I got home from work on Friday to when I left for work on Monday. That is my personal preference. That is not everybody's personal preference, though. So I would say that providers shouldn't be forcing people to go out and engage in their community if that is not something that they are interested in, if they're homebodies. Um, but if they want to and are unable to because, well, they can't all agree on one activity and we don't have the staffing to leave some people home and take that other people places or, you know, et cetera, that's a problem. And that, discussions need to happen around it because we understand staffing shortages. We understand that, it's not easy, but we have to figure out how to support our participants to have lives that you and I would want to have at the end of the day. And I'd be fine with it, but there's a lot of you out there and a lot of our participants that wouldn't. You'll see in a lot of the exploratory questions, it'll say, are people are there preferences around these things being honored? And that's a big element of the final settings rule because there isn't a one size fits all answer. But something that is kind of an institutional feature is applying a one size fits all answer in what activities we offer, how much we go out or don't go out, um, all of those things, you know, not allowing for individual choice, autonomy, and individualization across all the things we're going to talk about is a big element of what the final settings rule is trying to get us away from. The next element is choice of settings. I'm not going to spend too much time on a few of these because they're more straightforward, and some of them are actually more things that are our responsibility and than the providers necessarily, although the providers do have some responsibility in supporting some of these elements on their side. So the second aspect is the setting is selected by the individual from among settings options, including non-disability specific settings. The settings options are identified and documented in the person-centered plan and are based on the individual's needs, preferences, and resources. So some exploratory questions for this. Was the participant given a choice of available options of where to live and receive services? Was the participant given the opportunity to tour other settings than the one that they chose? Does the setting reflect the participant's needs and preferences? And do the options offered include services delivered in a non-disability specific setting? So are we making sure that folks are fully informed that they could live in their own apartment and get intermittent supports? Like they could have day services that don't involve going to a site or a hub. Like there are ways that we can do that. But sometimes I think, folks kind of get locked into those more traditional service models of group homes, what used to be called extended family homes, day sites, like workshops. Um, and so really educating folks on all of the different options. So somebody asked, what happens when a guardian wants a client to be in a setting they do not like? So there are some things that guardians kind of have unilateral authority over. A participant's residence is one that's kind of hard and fast, they decide. But we also have a responsibility, and our role can be to educate and advocate for participants. Um, so if you have a participant saying they don't like their day site verbally, or maybe you're seeing escalation in behaviors or things like that, but the guardian is not willing to, says they don't want them to change day sites. We can advocate, we can offer options. We can say, would you like me to just, like, I could set up a couple of tours just so you can see what's out there. No pressure, it's still up to you. But, you know, you can also, in that situation, talk to the participant about what they don't like. Like, is there maybe they really like this day site and there's something that something happened, you know, maybe their friends moved to a different day site in your area and they miss their old friends, and maybe the guardian says that this day site is still the best place for them to get day services, but you could support them to still have relationships with those friends that used to go to day services with them in other ways. Like, there's a lot of different things that we can do there, to advocate and to educate and to support our participants, but what we can't do is not have a conversation about it, not bring those things back to the team, not offer options, and not educate and advocate.
Hey Sarah, this is Jill. I'm
Mhm.
heading to another meeting, but the SDAs are on and they will help keep you with time if you'd like, but you have 1 hour left, my friend, and you have several slides. So thank you
I
for this topic.
do.
Thank you everyone for joining. Okay.
Only 15 slides to go. Um, okay, the next one is individual rights. The setting ensures an individual's rights to privacy, dignity, and respect, and freedom from coercion and restraint. So this covers a lot of things. Some of the exploratory questions: is there a readily accessible complaint process? And do they provide, and is information posted and made available about how participants can access that complaint process? Is private information kept private and discussed discreetly? So if you ever walk into a day site and two DSPs are yelling to each other across the room about somebody's bowel movements or medical diagnoses or something like that is happening, that's going to be a problem with this. It's an issue with privacy, and it's an issue about dignity and respect, because those are not things that we would like people discussing across a room full of people about ourselves. And we owe our participants that same respect for their privacy and basic human dignity. Are participants groomed as they prefer? There's that as they prefer. Some participants don't want to be clean shaven or, those types of things. But are participants groomed as they prefer if they need support with grooming, and dressed in age appropriate and seasonally appropriate clothing of their preference? Do staff talk about participants as if they aren't present? Do staff address participants as they prefer to be addressed? And are restrictions only used with informed consent and in accordance with division policy? So any issues with any of those types of things would potentially be a final settings rule issue with this requirement. So like I said, if staff are, discussing participants' medical diagnoses, treatments, or personal information about them in common spaces where everyone can hear, if staff call participants by like pet names, or sometimes we'll see them call them like kind of infantilizing names that aren't really the person's preference. And they're not doing it with ill intent, but they don't understand sometimes the message that is given when we don't address other adults as adults because they have a disability, right? And what does that tell the rest of the world at large about the human dignity and respect that we all owe that person? Using restrictions without all the appropriate approvals. If staff are talking about participants but not with them, that is something that happens a lot. If a participant needs support with nail care, but their nails are frequently long, ragged, and dirty, if participants, are sitting around and not changing out of their PJs or not changing out of stained clothes. Now, some people don't care and they would rather not change clothes more than what, during the day. And if that's their preference, that is what it is, unless it becomes a health and safety issue. But, if they're sitting around in their bathrobes all day when that's not their preference because, nobody cares enough to help them get up and get ready and get around in the morning, then that's a problem. Any questions about this element? So as we get into this, you can see, right, how this dovetails a lot with the conversations we've been having around participant rights. The next element is individual autonomy. So the setting optimizes, but does not regiment. Most of this, I did paraphrase some of the longer ones, but most of this is language directly from the regulation. The setting optimizes but does not regiment individual initiative, autonomy, and independence in making life choices, including but not limited to daily activities, physical environment, and with whom to interact. So, are there locked doors or barriers that prevent participants from accessing common or shared spaces or interacting with other groups of people? So that day site that was kind of in an industrial area that it might still be open. I really hope it isn't though. If it is, and what I'm saying rings a bell with you, let me know because we might want to look at it. But this day site also, it was like multiple garage bays, and people were sort of grouped up or organized by their level of developmental disability. That's just icky to say. But there was no, like, you couldn't go to a bay that wasn't yours. Like, everybody had a group that they had to stay with in their little assigned area, and they weren't allowed to go between or to eat lunch with folks in other areas or that type of thing. That's kind of what we're talking about here. Are a variety of group and individual activities offered to support participants with varying interests and needs? Can participants engage in legal activities for their age that can take place in that setting? Like, I know at day sites, like, nobody's there just having beers, in the middle of the day. But like at home, like, there's probably many of us that go home at the end of a long day at work and have a beer or a cocktail or a seltzer or a whatever. So are participants allowed to engage in activities that are legal for their chronological age that are that the rest of us engage in those spaces or those types of spaces? And can participants eat meals when they choose and with others or alone? So these are all exploratory questions that CMS gives us to kind of help us understand what they mean by this piece of regulation. So some potential examples of non-compliance. Like I mentioned, that one that I used to pull shifts at, there's doors between different areas or groups, and participants aren't allowed to go between them or interact with other groups. All activities offered are group in nature. Any rules around, not being allowed to vape, drink alcohol, smoke, etc. Now a day site, those are more equivalent to like a recreation center or a job that most of us might go to. And so drinking typically is an element of what happens in those spaces. But if the participant isn't allowed to take smoke breaks or isn't allowed to do those things at home, even if they need to do them outside, that could be a problem with this element of the final settings rule. The break room at the day site is kept locked so participants can't access food and drink and their personal items that are stored there without staff support. Yeah, these are all potential examples of non-compliance. Alyssa asked, how much control does a guardian have over an individual's personal choice? So in the example you gave here of a guardian wanting them to have a program to improve their hygiene, but the participant refuses, if it's not a health safety concern, the guardian can't force a person to complete those things. That's correct. Guardians have authorities that are laid out in state law, and beyond that, they cannot require us to limit participant personal choice in ways that are inconsistent with division policy in our waiver services. We did a deep dive into guardianship and what their authorities are and some of the, different considerations around that back in May. And those videos and slides are posted for folks to look at and use as a reference and refer back to. The next element is choice of services and supports. This one, again, is a pretty straightforward and sort of part of our responsibility as well. So the setting facilitates individual choice regarding services and supports and who provides them. So does a participant know who to talk to about requests to change providers? Would the provider support the participant to talk with their SC or team if they expressed a desire to consider other provider options? Does the participant express satisfaction with their service provider and supports? Does the setting ensure participants are supported to express their preferences and exercise autonomy to the greatest extent possible? Is the participant actively involved in the planning of their services and supports? So, like I said, some of these, if the person has a guardian, look a bit different. And some of them we as, service coordinators are responsible for part of it. But if a provider is limiting a participant's ability to be part of their service planning meetings, or not doing their due diligence and trying to support folks to be part of those meetings, if the provider is ever discouraging a participant from communicating to their SC that they may not be happy with how their services are going or anything of that nature, it could be a problem with this element to the final settings rule. Lease or residency agreement. Now I'm going to say that at the end of this, I have a list of resources linked on the last slide. One of the things that I linked, because we get a lot of questions in the QI team about leases, I attached a handbook from Legal Aid of Nebraska that kind of answers questions about landlord-tenant laws and tenant rights and things like that in our state, because every state is different. So that is something where if you see something happening where the provider is saying, oh, we're allowed to do this because it's in the lease agreement, but it feels wrong or problematic or something that you wouldn't be okay with a landlord doing in a lease that you signed with them, those are things that could be a concern here, because this requirement says the setting provides, this is only residential, applicable to residential settings, so group homes and SLPs. The setting provides a legally enforceable agreement between the provider and the consumer that allows the consumer to own, rent, or occupy the residence and provides protection against eviction. So does the participant have a lease, or for settings where landlord-tenant laws do not apply, a residency agreement? The residency agreement is more something we see in assisted living facilities, but most of our participants who live in group homes and SLPs have lease agreements. Does the participant know their housing rights and when they could be required to move? Does the written agreement provide protections to address eviction processes and appeals comparable to local landlord-tenant laws? Does the lease agreement contain provisions that are legally enforceable and not in conflict with other applicable law, regulation, or policy? So it's not just something that happens with folks with disabilities. Landlords put things in leases all the time that are predatory in nature and that are not legally enforceable. This happens everywhere. And so just because something is in a lease and a participant has signed it does not mean that that is valid or allowable or legal or legally enforceable. If you have a concern about those things, we aren't asking you to parse out the legalities of those, but if you see something that is really concerning, those are things to, staff with your supervisor, potentially escalate, or those types of things that we can take a look at. So if there's no lease in place in a residential setting, if the lease agreement does not contain protections from eviction and appeal rights, those are all non-compliant with the final settings rule. If the lease states the participant waives the right to appeal an eviction, that is an example of something that is really common in leases that is not legally enforceable. Or if the lease states that visitors aren't allowed unless approved by the landlord or provider. That's an example of, I don't know if it's legally enforceable or not, but it is a term of a lease that is directly in conflict with other elements of federal regulation governing those settings. And they cannot use a lease to circumvent federal and state law, regulation, and policy. Amanda asked, when a person receiving supports breaks the lease, are they responsible for penalties landlords can impose for breaking of the lease? What if the person receiving supports wants to change providers in the middle of the lease? So that is something that is maybe a bit different for folks who are in developmental disability services. because most of us, when we take out a lease, we're just leasing a residence or a space. But when our participants are signing a lease, they're creating a relationship with that service provider, that they're going to receive services from that provider. And CMS has also been very clear, because we used to have a regulation in Nebraska that participants had to give providers 30 days notice before changing provider agencies or changing to an independent provider. And we were told kind of strongly by CMS that that needed to be taken out of our regulations, because participant choice in service providers is an element of final settings rule. So those would be things that might look a bit different. And those are things too, like if a participant has a guardian, that we can, talk with them about being mindful of when they're signing leases on a participant's behalf. Or if a participant doesn't have a guardian, things that we can talk about them with. And we can, if there's a legal question about their lease or an eviction, anything like that, there are legal resources we can help them access or make them aware of. They can help them with those things if it's kind of outside of our scope and expertise. The next one, privacy, roommate choice, and decor and furnishing. So this element says the setting provides for privacy in units, including lockable doors, choice of roommates or housemates, and freedom to furnish and decorate the sleeping or living unit within the lease or other agreement. So when they say unit, there's some elements of this. When they say unit, they're talking about the participant's bedroom, their personal space. But in the context of like an assisted living on the AD side, it can be their living unit, so their apartment at the ALF. It could be, that some things like the lockable door element is applicable to their sleeping unit, but other elements are applicable to the home that they rent in general. If they're renting a room in a house, some of this stuff would govern not just their bedroom, but common areas of the space. So can the participant close and lock their bedroom and bathroom doors? Do others knock before entering private spaces? Are keys to the home given only to those who need them? Is the furniture arranged as the participants prefer? Are there cameras present in areas that have an expectation of privacy? Do the furniture and household items reflect participant personal choice? And do participants have private rooms or share rooms only if they choose to and with whom they choose? So nobody should have a roommate unless they want to have a roommate and they want it to be the person who is their roommate. That's a big element of this. So this first example of potential noncompliance is something we actually came across recently, where the participant only has a curtain separating their room or their bed and sleeping space from where staff were sleeping and keeping their things. The provider issues a master key to their group home staff that works on many different homes beyond the one staff works in. That's not okay. The only folks who should have a key to these people's home are the people who are coming there to support them as part of their job, or people that the participants want to have a key to their home. If participants weren't allowed to decorate their room or the common areas of their home within reason, furniture is arranged by the provider and participants aren't allowed to move things around, or staff go in and out of participant rooms and bathrooms when they're occupied without knocking or asking permission to enter. They just kind of barge in. And even when we know that somebody needs our support, maybe in the bathroom, or help with changing in their bedroom after a shower, it's still, customary to knock and make sure that they know you're coming in to support them before you just barge in. Renee said there's an agency in Omaha that has a policy across the board saying individuals cannot use their petty cash to purchase pop or snacks at the day site because it causes issues. I would like to talk with you more about that. we'll come back to that, Renee, if we have time. Amanda asked, would a keyless lock on a bedroom door be out of compliance since the SLP would, in a way, have a master key by knowing the code? So a participant having a lock on their bedroom door doesn't necessarily mean a lock that no one can, get through but them, because some of our participants have risks that necessitate somebody going into their room to make sure that they're being safe or to intervene if we know that they're not being safe. So it doesn't necessarily mean a key that staff don't also have a key to. It just means that they have the right to safeguard their privacy, and kind of limit access to only those who need to come in. Those people coming in and out, even if they have a key, should knock. Those people should only enter a closed and locked room if it's absolutely necessary, for safety, or because we know the person needs support. And they can use it to safeguard their possessions and their privacy from maybe other residents of that group home or other members of the household besides their SLP who needs to support them and make sure they're safe. Somebody said, in regards to decorating their room, do we need to document in the ISP if they don't decorate their rooms? I have quite a few that engage in physical aggression, property destruction, etc. So that's why they don't have decorations up due to destroying them. I mean, again, decorating is to your preference. If you look behind me in my cubicle, you'll see that I have a plant and a skeleton with a bunch of weird things and my desk pets around. Like, that's my preference. There are cubicles in this office too, where if the person isn't actively working in it, you would presume that it's vacant because there's nothing there. Everybody kind of has their own preferences for things like that. So if a participant has shredded all of the decor that they've purchased, if they want to buy more and continue spending money in their fashion, as long as it doesn't threaten their ability to make sure that their basic needs are met, that kind of is what it is. But, the decor is about the participants' preferences, not to be performative in nature to say that the setting is homey and decorated. That's not what this is about. And it doesn't add any value for our participants. So we have to be careful of that. There was a setting that I went to a team meeting because there was some contentious stuff going on that I was asked to be a part of that discussion. And something the provider has done. So there's 3 participants living here. They're all young men in their like 20s, residing in this group home. And I went into the bathroom and there was like a wooden lighthouse and like a bowl of seashells. And I'm just like, they didn't pick this. The people who live here didn't pick this. None of those guys went to Home Goods and picked out a wooden lighthouse. That's not, like, I've never been in a shared residence of 20 something dudes and found a lighthouse in their bathroom. Like, this was performative to make it feel homey to say they were complying with this. And none of that is necessary. The home should look like the people who live there and have the things in it that those people want to have there. The next element, number 8, schedule, control, and access to food. This is a big one we talk about a lot, both from a rights perspective and from a final settings rule perspective. So the setting provides options for individuals to control their own schedules, including access to food at any time. So exploratory questions are, can the participant choose to eat their meal at the time and place of their choosing? If there's a menu, can the participant request an alternate meal if they don't like what's on the menu? Are snacks available and accessible at all times? Is the participant able to eat alone or with whom they choose? So going back to that example of that day site that I worked at, everybody had to eat in their own little bay with their own little group, and they couldn't go eat lunch with the other groups if they wanted to. That would be something that, you know, potentially a violation of this element of the final settings rule. Is it clear that the participant isn't required to adhere to a set schedule for meals, bathing, waking, bedtime? So if we're getting the impression from things we hear, things we observe, that everything has to be shut off and everybody has to go to their room at 10 p.m. in a group home, that's a problem. Unless magically all of the people in that room, that is their expressed personal preference. But there's 2 people in my household, and my husband stays up until 4 a.m. And sometimes I go to bed at 9:30 because I'm just done with the day. You know, it feels unlikely that there's a group of people living together and they all simultaneously choose the same bedtime. That might be something that tells us we need to ask more questions. Does the participant schedule vary from day to day or differ from everyone else's served in the same setting if that's their preference? So if we go into a setting and everybody's schedule is the same every day and everybody and the same as everyone else's, if that is magically everyone in that setting's preference, then okay. But I think it's a cue for us to ask questions if that's really what those folks want or if that is being imposed on them. And if we are seeing signs that it's imposed on them, those are situations that we might want to take a closer look at. Kristen says, I was at a day site a few months back where they had assigned meal times and appeared to be strongly discouraged to eat outside of that time. This would be considered an access to food issue depending on how it's enforced. Potentially, for sure. You know, I would need, because I mean, sometimes we compare like what happens in day sites to like, you know, kind of what we experience in jobs and stuff. But like this for me doesn't wash necessarily in this type of situation. Just because like at jobs, there's a compelling need for people to stagger their meal breaks. So phones are manned and so, you know, desks are manned and stuff like that. But our day sites are really more similar to like a recreational center like the Y or a senior center or something like that, where other than, you know, convenience of staff and control, it often seems like there isn't a compelling reason why everybody has to eat their lunch all together at that time. And so if that's the case, it could certainly be non-compliant with the final settings rule. Definitely a reason to ask more questions. Visitors, this one, we think sometimes of visitors in home settings, but it does apply to both residential and day settings. So this element says that the setting provides individuals with the freedom to have visitors at any time. So exploratory questions. Do day sites encourage visitors from the broader community or otherwise encourage interaction with members of the public? Are visitors allowed? Are visitors limited to specific hours? Are visits restricted to certain areas of the setting? And do visitors have to be approved by the provider ahead of time? So examples of potential non-compliance, a participant's family or friend can't visit them spontaneously for lunch at their day site. If that wasn't allowed, that could be a problem. A participant is not allowed to invite a friend to visit them at their home. If there was a rule at a setting that overnight guests are prohibited. Now there's some things about that because in Nebraska landlord tenant law, like if you are an overnight visitor at a place for more than a certain amount of days out of a certain amount of time, technically you legally reside there and would have to be on the lease. And so like there are some legal limits around that, like from landlord tenant law, but like saying that it's not allowed at all, period, is problematic in terms of the final settings rule. If visitors are only allowed in the living room or another common space and aren't allowed to go talk with the participant back in their room or something. If visitors have to be approved by the provider and their housemates teams before they can visit. I actually saw this in a lease very recently. That is a violation of this and not a legally enforceable term of a lease. Because I've never had I haven't been a renter for a few years, but I've never had a landlord tell me that they had to approve every visitor that I have. That's not normal. And a participant is allowed to visit their friend at their home, but that friend can't come visit the group home. Those all would be situations that might be in violation of the final settings rule. And Rachel said, I've seen T-logs where staff are logging what participants bring for lunch. Like they're just writing it down, or they're like controlling what participants bring for lunch. No, I mean, it's unless there's a concern for that participant's health or nutrition, it's sort of odd. But I don't know that it's necessarily restrictive unless they're, ignoring the participants' wishes about what they want to eat, when they want to eat it, or access to food generally at any time that they want. And this is the one that I want to come back to. Renee with the provider who says participants can't use their petty cash to buy pop or snacks at the day site. That is a violation of number 8, the one we were on just before this, with the access to food at any time. So that's kind of the element that I want to talk more about that under. What about when the participants are involved in online or social media dating sites, presents a safety danger to the participant or staff in the SLP? That's a really real risk. And that may be a reason why a rights restriction in that area might be appropriate. But we have to be reasonable about real risk versus perceived risk. Sometimes I think that folks will say things like that are a risk when maybe they will maybe exaggerate the extent to which stuff like that is a risk, because they don't believe that people with disabilities should be having, romantic or intimate relationships. And so not to say that there aren't limitations that can be placed around that if the participant is really putting themselves in unsafe situations, potentially, or others in unsafe situations. However, we have to be really thoughtful and careful about those. Jennifer asked, is signing in and signing out of participants, tenants, and visitors in apartments considered a violation of this rule? Not necessarily. This is something we see, maybe not so much on the DD side, but something that we see as a common policy in assisted living facilities. And if it's just to keep track of who is there in case there would be an emergency, that there would be a need to know who is in the building and evacuate or something, then I think it's okay, as long as that doesn't cause there to be undue limitations placed on who visits participants and when. And the last element is physical accessibility. So the settings must be physically accessible. And, you would think in the day of, the ADA, that is federal law that came about many years ago, but there's a lot of settings that still aren't accessible to folks who use wheelchairs or have, vision impairments or mobility limitations. And so it is a requirement that settings where home and community-based services take place must be accessible to the folks receiving services there. So are there grab bars, ramps, and other accessibility items in place for those who need them? Are there viable exits for emergencies for everybody based on their mobility needs and that type of thing? Are appliances accessible to the participants in their homes? Are tables and chairs at convenient heights and arranged so participants can use the furniture comfortably? Is the setting free of obstructions that would limit participant mobility within the setting? If obstructions are present, are there environmental adaptations like lifts, elevators, ramps, etc.? So some potential, examples of noncompliance. If the bathrooms at a day site aren't large enough for a person who uses a wheelchair to be supported to use the bathroom in. So that means room for the person, room for their wheelchair, and maybe room for somebody to assist them if they need it. If emergency exits aren't accessible to those with mobility needs. Something as simple as a home where a person resides, if that person is in a wheelchair, having a front-loading washer and dryer so they can do their own laundry to the most independent extent possible, instead of having a top-loading washer that they're not going to be able to get. Sometimes I have trouble getting down into the washing machine. Not trouble, but I hate it. Laundry's no fun. Are we making sure that they have appliances that are accessible for them to use without staff support if they're able? If the furniture is arranged in a way that makes it difficult for people with a fall risk or mobility limitations to navigate their environment, if there's a step between areas in the home or the day setting and there's no lift, no ramp, making those areas or going back and forth between them inaccessible to anybody who uses a walker or has a mobility needs or uses a wheelchair, and there's no ramp, lift, etc. Or if lighting and visibility accommodations aren't made in the home of somebody with a vision impairment. Those would all be examples of where a setting isn't being made physically accessible to a participant. So those are the 10 requirements. So now we're going to talk about modifications, and this is kind of what I was mentioning before. So these aren't absolute. What they look like can be situational, just like rights in general, but also these things we know, and CMS knows that there are some folks that have needs and risks that necessitate us not following the exact letter of some of the elements of the final settings rule. And so the federal regulation allows for, they call them modifications of requirements in the final settings rule. And so that is allowed. However, it is only allowed when the need for modification is supported by an assessed need and justified in the participant's plan. So a lease or a provider policy that limits all of the participants in that provider services in a way that is against the final settings rule is not permitted. The modification of elements of the final settings rule can only be done when there is a specific individualized need only in the spaces where that person receives services. And when we are making modifications, we have to document in the person's plan the specific individualized need, positive interventions and supports used previously, less intrusive methods that have been tried, a description of the condition that is proportionate to the assessed need, collection and review of data to assess the effectiveness of the modification, time limits for periodic reviews, informed consent, and assurance that interventions will not harm the participant. So some of these, well, I think I have it on another slide, but you can see how some of these things directly line up with restriction safeguards. So that's what federal regulation says about modifications. So when we are going to diverge from anything that is expected under the final settings rule, it is expected that it's only done under these circumstances. So how does this, what does this mean in terms of what we've been talking about in our regulations and our policies around participant rights? So as I mentioned, and as you probably noticed, there's a lot of elements of this that are things that we would define as rights our participants have, because we all have those rights. Rights to control our own schedule, rights to access food at any time, rights to come and go in our own homes, rights to access the community as we choose. So a lot of the expectations under the final settings rule are things that we expect that are that are rights. So even if the final settings rule wasn't a thing, we would still have those expectations in our services because of our policy around participant rights. However, there are some things that I think we maybe haven't traditionally considered to be rights, like having leases. Like there are some people that live with a family member that don't have a lease. Or locks on doors is another one. You know, I don't have any children and my pets can't work doorknobs yet. So there's no locks on some of the doors, the interior, like bedroom and bathroom doors in my house, because it's with my, you know, lifestyle and who lives in my household, like it's not generally a problem. And so like, I wouldn't say that somebody is depriving me of my rights to have locks on my doors. But the federal regulation kind of expanded what we understand to be rights for people served in these types of settings. They kind of raised up the bar in some of these elements of things that we wouldn't typically talk about around participant rights. Now, if a person wants a lock on their door and they're being told no, we would, under our policies, consider that to be a rights restriction, but it isn't, you know, before the final settings rule, that wasn't the default, that there was an expectation that everybody who resides in DV services has a lock on their bedroom doors, has a lock on bathroom doors in the house. And so, you know, another element of it is, you know, we always would have identified it as problematic if the person is being actively prevented from accessing their community as they want. But the final settings rule kind of has asked us to think about it in terms of folks don't just have a right not to be segregated from their communities, but we have a responsibility and an expectation across the board to actively support their full integration in their communities. So these are some elements of the final settings rule that have kind of gone beyond, you know, the bare minimum of individual rights that we think about. Elizabeth said, can a guardian make a decision to not have a lock on the door in lieu of a client who does not communicate verbally? There's a lot of things around that. I would expect that there be a compelling reason why. And some other things around that. Those, like with everything else, really, really depends on the circumstances, the intent, a lot of those elements. So yes, there are situations where folks don't necessarily have locks on their doors, but we want to be wary of that and have thoughtful conversations around those on an individual basis. But I will say to that, Elizabeth, just like all of our other regulations and policies, a guardian just on their whim they don't exempt our providers from following regulations and laws and policies that govern that provider's business and services. And so we have to be careful around that. So as I mentioned, elements of documentation for those modifications also intersect closely with our policies around what needs to be documented for rights restrictions. This is another reason why thorough documentation of rights restrictions put in place by the team is so important, especially around those rights that align with things that are explicitly named in the final settings rule, like access to food, community access, visitors and relationships. You know, not only are those safeguards and things that we have to document important in terms of our federal reporting and our, you know, responsibility to make sure that we're, you know, acting as a meaningful safeguard to participant rights. All of those things are also elements of compliance with the final settings rule in most situations. Another thing that federal regulation does is it ties compliance to the site where the services are delivered, not necessarily just the person delivering the services. or the people delivering the services. So these sites are owned, leased, operated, or controlled by waiver providers. That's why they're subject to the final settings rule. And the final settings rule really places responsibility for what happens in those sites and the compliance of those sites in the hands of the provider, even if that setting is someone's family home, if their SLP is a family member, or even if that is a contractor's private residence. When they choose to become a waiver service provider, either, as a contractor, providing shared living or host home services as an employee, their home is no longer just the family home or their private residence. It is a Medicaid funded services site, like an assisted living, like a day site, like a hospital, like a nursing home, like not the same as some of those, because some of those are institutions, but like it becomes subject to rules and policies that it wouldn't be if it's just a family home. And so we see sometimes where family members have become the shared living provider of participants, and they want to continue to support the participant at that family level relationship and operating their household as it always has operated, oftentimes in violation of the final settings rule. And sometimes oftentimes also our policies around rights and those things. And those are distinctions that we really need to be mindful of and help people draw. If you're getting paid Medicaid funds for services that you deliver in your home is a Medicaid services site, and the agency that you contract with is responsible for what happens there and is responsible for ensuring what happens in that setting is compliant with all of the applicable laws and regulations, including the final settings rule. And that is something that is difficult for some folks. So what do we do with that? Because like I said, if we are telling people, you have to kind of take off your family hat and put on your provider hat, because even though you are related to the participant you're supporting in your home, you are not different from any other DSP out there or any other shared living provider who isn't family of the participant. You are first and foremost, when you're on the clock, a Medicaid waiver services provider, and you have to be following all of the applicable rules and regulations. And if that is not something that folks are amenable to, they don't want to have that type of relationship with their family member, that is what it is. But if they're going to accept Medicaid payments from Medicaid dollars are coming into their homes, coming into their pockets, then they are accepting these rules and responsibilities. And that's a struggle for some folks. And so what do we do with this? The responsibility for monitoring compliance with the final settings rule is, in a general sense, the responsibility of everyone in the division. But there are folks that is, a big chunk of or the primary piece of their job. Most of you on this call, I know I see Stephanie, so I knew at least some of the folks who are in that boat are on this call, but most of you in service coordination, this isn't necessarily your primary responsibility. But you are also the ones who are out and about and meeting with our participants face to face. So when you notice possible non-compliance with elements of the final settings rule in your service reviews, in your ISP reviews, in your TLOG reviews, GER reviews, you can raise those concerns with participant teams and providers. And, sometimes when you're having those hard discussions about participant rights and restrictions and things like that, if the limitation or restriction that is being discussed is not only, a restriction or potentially problematic under our state policies and regulations, if those things are also problematic from a final settings rule perspective, that's an additional element you can bring to those conversations that could maybe help people, you know, work through their objections. Like this, this isn't just a state policy. This isn't just, the division saying you can't have what you want in this situation, or, we have to call certain things a restriction or have to document them a certain way. There's also federal regulation that speaks to people having access to food at any time or being able to have visitors at any time or things like that. And if we're going to place limitations on that, we have to do so not just in compliance with division policy, but in compliance with federal regulation too. Any questions about that? Kristen, I see your question. I'll come back to it. I think I just have this one, maybe one or two more slides. So as I mentioned, there are some people in the division whose primary responsibility is doing oversight. They go out and do on-sites, they review provider self-assessments. So we do have some folks on the QI team who specialize in monitoring compliance with the final settings rule. So we aren't, asking you all to go out and be the primary enforcers of the final settings rule, but you have eyes, you have ears, you're going to see things that make you go, in light of all of this information we've been talking about today. And if you want to approach teams and providers about those things, you're welcome to. You're welcome to stop them with your supervisors and your SDAs and work on them in your local areas. But also want to put out there that we have folks who this is a big chunk of their job. And so if you aren't sure whether what you've observed is problematic in terms of the final settings rule, or there may also be times where you've brought up an area of concern or non-compliance to a provider's attention and they've disagreed, or they've said, yeah, we get it, we'll talk to the person, but you don't see that the issue gets resolved, or isn't, the provider isn't ensuring that what takes place in that setting is compliant with the final settings rule. In those types of situations, you can certainly escalate those through your SCS. I would absolutely start there first. But talking those through with your SCS, and those can be escalated to the QI team. And we can do a lot of things. We can send people out to do on-site assessments. We can review records, and we can, as kind of the folks who have a higher level of expertise on the final settings rule, determine whether the setting is out of compliance. And then we also have established processes through which we notify providers that their settings are out of compliance and give them a timeline to bring the setting into compliance before potential sanctions. So it's another tool in your toolkit. There may be things that are problematic from a perspective of our division's policy around rights, but if it's also something that is problematic under the final settings rule, or maybe it's system-wide for a provider, so it doesn't make sense to have the 20 SCs who have participants impacted by that issue having a back and forth with the provider on an individual basis. Maybe it makes more sense to approach the provider from a broader perspective. Those are things that we can do on our side, and we have established processes that we look at and remediate those issues through. So so that's all the slides I have for today. We have 8 minutes left. I have one question in the chat that I haven't answered, but keep putting them in the chat. We'll work through any more that you have. And once we get through that, you can unmute and ask your question, any questions you have. Also, but the last page of the slides for today, which are attached to the invite, are some resources. So if you are very interested in the actual language of the federal regulation, it is linked here. This is the citation for it. These are things that you may not be super interested in. It's fine. I'm a policy geek, but not everybody is. But these are things that when you have discussions with providers around these topics and they say, oh, I didn't know that. Where does it say we have to do that? Where is that requirement? Here is that requirement. These are links and resources that you can share with providers too. So that is a link to the federal regulation, the actual text of it. There's also a link to our division's final settings rule page. On this page, you will find a visual aid that lays out those 10 federal requirements. There's a poster, and then there's also just like a letterhead with the 10 requirements on there. Our state transition plan that we had is on there. There are several.
This is Rachel.
I think Rachel got a phone call and thought she was muting herself and unmuted herself. It's cool. It happens to the best of us. There's some recorded CQL trainings that I would encourage anybody who wants to know more about this topic to avail themselves of, but also things you can direct folks to if they want or need to know more as you're having conversations with them about final settings rule. They're from the Council on Quality Leadership, and they're really great. There's 3 of them that are less than 10 minutes long each, and then there's one that's like about an hour long. So those are great. And then our assessment tools that our QI team uses when we go out and do on sites are on the website. And there's some other resources and stuff that our teams have developed to help folks understand these expectations better. Then I also have linked here the toolkit that was put out by CMS. That is where CMS has issued technical guidance on a variety of topics about the final settings rule. That's also all of the exploratory questions that I had on each slide. Those came from exploratory questions that CMS put out, and the full documents of those exploratory questions are also in that toolkit. And then the last thing I've linked here is the Landlord Tenant Handbook. It's a resource developed by Legal Aid of Nebraska to educate tenants on their rights under Nebraska state law. There's a lot of great information on there. It's a resource you can share with participants and guardians if there's concerns about a lease. And it also says on there in many places, if this happens to you, please call legal aid. And has like contacts and mechanisms and information about how somebody could go about doing that if they needed legal support in a landlord-tenant dispute. So that is also something that you can share. So questions. Kristen says, earlier you talked about how low staffing not being an excuse for non-compliance for things like community access or preferring solitary time. What ways can providers address these things like community access in light of short staffing? I mean, it's a persistent problem. It's across our system, and it's not an easy one to solve. And there may be times when it's just unavoidable, but it shouldn't be every single day. It shouldn't be the reason that participants never get to go to the movies or out to eat or things like that. You know, and I would also say, is the provider, you know, if staffing is an issue, are they supporting the participants to, you know, do they have family or friends that can help them? You know, like DD paid services aren't the only solution for accessing the community. If the person's capable of independent transportation, are they hooking them up with a bus pass and teaching them how to understand the bus routes? If they have the money and the ability to navigate it, are they helping them download Uber on their cell phone to be able to get a ride to where they want to go? Are they, you know, somebody really wants to go out to eat, we just don't have the staffing for it. Can I help you call a friend and see if they want to go out to eat and grab dinner tonight? Or let's ask your sister, maybe she'd like to grab some Chinese food with you. There should be active efforts. You know, I get that there are barriers, and staffing is definitely one of them, but barriers should never be the end of the conversation. They should always be a beginning of a conversation of what can we do? This barrier is what it is. What can we do? because a lot of people bring up barriers in conversations as sort of like a conversation stopper. Like they don't want to talk about this. And so they'll say, well, there's all these problems with it. So we can't do it. Let's just stop talking about it. That should never be how this goes. Barriers should always be the start of a conversation of what else can we do? We can't change the staffing. We can't magically make trained bodies appear to support these folks to access the community however they want. What else can we do? Any other questions? If there aren't, I can come back to Renee about the agency with the policy across the board saying individuals cannot use their petty cash to purchase pop or snacks at the day site because it causes issues. What issues, Renee? If you don't mind me asking, and you can type or you can unmute yourself.
I think some of it is some behavior. So if one person sees that this person has a pop, they want pop, and they may not have enough petty cash to then get themselves a pop. And so I think that's part of it. I mean, that's anywhere. And actually, there is another service corner that says there's a couple agencies. Yeah, there's a couple agencies that are actually doing it. So just because I think they think because it's policy and it's written into their policy that they can get away with it. And I didn't want to get into an argument about you restricting everybody,
Yeah.
like so.
Well, and are we supporting those folks who have those issues or those behavioral issues? Like, how are we supporting them to work through that? But like someone else's behavioral needs should never be why I can't have food and drink during the day. That's bananas. So yeah, so they, if you could just shoot me an email, though there's conversations that need to be had around that. Because yeah, that's I want to have more conversation. I want more information, but based on what you're telling me, I'm having trouble seeing how that could possibly not be non-compliant with the final settings rule. Without all the information, like I said, a lot of this, those nuances and circumstances do matter, but at face value, it's definitely something we need to have more questions and conversation about at the very least.
Okay.
Any other questions? Okay, well, we're at 2:31, so I'm out of time to answer any more questions you might have anyway. But as always, if you are marinating on this information and you have a question that comes to you later, please feel free to reach out. If you have situations that you have concerns about in light of what we've talked about today, please, have those conversations with your SCSs. Your SCSs can help you escalate those if it's appropriate. We're here to help because, like I said, in a general sense, making sure that our participants, have the lives that they want and lives that any of us would want to live ourselves, and compliance with federal policy along with that is so important, and it's all of our responsibility in different ways. So be mindful of this as you're having conversations with teams, as you're out and about. And if you have any questions or we can support you to navigate situations around this, please feel free to reach out. And thanks for joining us today.
Thanks, Sarah. Bye, everybody.